Good morning again. This is Kathy Dale from the State Center for Health Statistics, and we're going to spend the next few minutes talking about the access to exercise opportunities. This is an indicator that is taken from the Robert Wood Johnson County Health Rankings website, and it is built upon some composite data that includes the business analyst data, the Delorme map data from ESRI files, and the U.S. Census Tigerline files. And the purpose of this indicator was to help us in our decennial work trying to improve the health of North Carolinians and our communities in the Healthy North Carolina 23 report, and also in the State Health Improvement Plan for 2020. And all of you are gathered here today in an effort to help us edit and enhance the 2020 State Health Improvement Plan to make it stronger, better, and more viable when we release the revised plan in 2022. If you were to look at the snapshot of the county health ranking file, as you see here, you would see a couple of images. One is a listing of the North Carolina counties where it gives a percentage of the population that is believed to have adequate access to locations for physical activity. For example, here, Alamance for 2019 data as reported in the 2021 health ranking says that 80% of Alamance County residents have probable access to locations for physical activity. And then you see a composite map over on the right where it proportionately takes counties that are in certain groupings, either the 0 to 29%, 30 to 49, on up to 90 to 100%. And it groups counties by their characteristics. So that counties in dark blue would be the ones that would be considered not as well off with respect to having their people have access to locations for physical activity, compared to counties that that are in the white here, where it's believed that 90 to 100% of their residents would have access to locations for physical activity. The numerator in this exercise opportunity indicator identifies household populations from the 2010 census, and then looks to see the census block that they're in, and then they look to find out if there is within a half mile or less of their border a park, or if they are within 1 mile or less from a recreational facility if they're in an urban census block, or 3 miles or less in a rural census block in the 2019 assessment. Parks include local, state, and national parks, and recreational facilities include things like YMCAs and any businesses, including a wide variety of facilities such as gyms or community centers, dance studios, and pools. These are all identified by following the standard industry classification codes. And the denominator data for that percentage would be the 2010 resident county population. Beginning in 2021, the data are displaced now into quartiles on the snapshot, so that rather than saying that a particular county is ranked as in North Carolina as between 1 and 100, that snapshot is now going to put your county in a quartile, either 0 to 25%, which would mean it would be one of the least healthy counties for this particular indicator, or anywhere from 25 to 50, 50 to 75, or the highest quartile, 75 to 100%. And so they've moved away from this ranking of the counties for this particular indicator. Probably other indicators will follow suit, and now we'll be able to, you'll compare yourself in a quartile measure. And we'll see that in just a second. So the data files are combined in ArcGIS, and that's what creates the measure. ArcGIS Business Analyst comes out of the University of Wisconsin. It can give you more information than even what's provided publicly. But it also uses a well-known entity, the Delorme Map Mart and Esri Public Use GIS data provided geocoded files. And this data are projected for parks at the local, state, and national level onto that mapping system. And then, of course, it's layered with the U.S. Census Tigerline files for spatial extracts. And it contains the features such as roads and railroads and rivers and legal and statistical boundaries for geographic areas. So even though this is a fairly complex measure, it's still not a great measure for being able to measure progress. And part of that is that because the files that make up the indicator are difficult to update on an annual basis. So some of them have different schedules for when new data will be released. Sometimes that may be as frequently as a year. Some of it may be several years before you get new data being infused into that modeling. You also are aware that rankings themselves don't represent statistically significant differences between counties to counties. And in the past, that has become problematic because County 1 may not be statistically any healthier or less healthy than County 2. Access to exercise opportunities is not inclusive of all exercise opportunities within a community. For instance, you can have sidewalks, and many people use those for running or walking. And then there are malls, which may have walking clubs, and schools, which may have gyms that are open to community members. But none of these would be captured in this particular measure. We also have some limitations in how we define access. So even if you have within a census block a park, access to that park may be complicated, maybe because of the location of its entrance or busy streets. Access could also imply a cost where users may be charged a fee to use that facility or an entry fee. And we all know that parks are not all equal and not all walks are equal. Parks may or may not include vastly different amenities. And though distances used in this measure approximate a 5 to 10 minute walk to a park, that may be more or less reasonable for different communities based upon their walkability and other factors. Research indicates that parkland is not always equitably resourced, even within states or cities. So thank you for giving me the opportunity to provide a brief overview of the indicator that we're using in HNC 2030 and to give you a little heads up about how that indicator may be looking as we watch for the composite values to change, and you'll see that reflected on their website. Thank you.